This is not about freedom or personal choice. It's about protecting yourself and those around you. What more is there to wait for? What more do you need to see? We've been patient, but our patience is wearing thin.
That was President Biden slamming the unvaccinated while announcing new mandates that will affect 100 million Americans. This new mandate that he is instituting affects federal employees and contract workers and healthcare workers. But the president yesterday also took it to the private sector, announcing private sector workers at large companies will be subject to vaccine mandates or weekly testing. He said any company with 100 or more employees will put that mandate in place. Joining me right now is Dr. Marty Makary. He is a Johns Hopkins School of Public Health professor, and he is a former World Health Organization official. Dr. Makary, it's always a pleasure to see you. Your reaction to this new mandate coming out of the Biden administration?
Well, there's a lot of issues of liberty and federalism and politics, but those aside, I can tell you from the medical side, there are some concerns I have. Right now, for example, the interval between those first two doses, the mRNA vaccines, may be too narrow. We should probably be recommending the second dose at 3 months, and that may obviate the need for any booster in the future. That may be the best interval. We can't do that with this mandate. Second of all, in adolescents, the dose may be too high. And that's a concern because kids do get myocarditis. And so 1 dose is what I recommend for adolescents at this time. And finally, natural immunity was not mentioned once. That's at least 100 million Americans. They have immune protection that's 27 times more effective in preventing symptomatic COVID, according to the Israeli data. And that was not mentioned once. They don't have to get a vaccine. They can get 1 dose, but they should not be required.
I love all of these ideas, Dr. Makary. I have not heard you discuss these ideas before. This is really important, all of the things that you just said. Let's go through them again. Number one, in terms of the distance or the time between the vaccines, I was looking at the Mayo Clinic study where it said that in the 7th month, these vaccines lose immunity significantly. According to the Mayo Clinic study, the Moderna vaccine goes from 90+% all the way down to 76%, and the Mayo Clinic study has the Pfizer vaccine going from 95% all the way down to 46% in the 7th month. So your point about stretching it out and doing a second shot after 3 months makes a lot of sense. I don't understand why this administration constantly says we're following the science. It's the science, when in fact you just laid out the science. And what they're saying makes no sense to do a second shot after 3 weeks or 4 weeks. That's number one. I want you to talk more about that. And number two, this whole idea of immunity from the infection. I agree. Why is the White House downplaying the immunity that one gets from the infection? Even Dr. Ben Carson was with me a few weeks ago who said, look, when you look at those people who've already had COVID and those people who've been vaccinated, you're talking about 85% of the country is now with immunity. So why are we downplaying the fact that if you had COVID, you just said it's 26 times more immunity than the vaccine?
That's right. That's right. And the data are now clear, and it's withheld the test of time. And natural immunity is real. It's durable. It's effective. And for those healthcare workers, for example, who risk their lives early on to take care of COVID patients, they have circulating antibodies. The idea of immunizing those already immune makes no sense with the new data that's come out. And by the way, many vaccinologists now are saying that the first 2 doses were so close together, they essentially functioned as 1 dose. And the magic number may be 2, wow, but the second dose needs to be months out. That's why I got my second dose 3 months after my first.